Welcome to the NYC Health and Hospital Kings County YouTube podcast. I'm Dr. Susan Law, Director of the Stroke Center, and I'm hosting this season's focus on stroke care at Kings County Hospital. This episode is about acute stroke care with special guests Ms. Rose Simpson and Dr. Hope Taitt from the emergency department. Hi.
Hi, Dr. Law. Hi, everyone. I'm Dr. Taitt. I'm an ED attending physician in the emergency room. I'm also the fellow there.
Good evening, everyone. I am Nurse Simpson. I am the Director for Nursing at the Kings County Emergency Department.
So I would say that you represent the emergency department at our storied hospital, which is level 1 trauma center and an excellent stroke center, if I do say so myself. Let's talk about our stroke patients. How does the ED prepare for a stroke patient?
Patients will come in via the ambulance bay or they present by walking in. We have 2 separate areas to receive these patients, so I'm gonna break it down. The patient who walks in will be assessed by the visual nurse. The visual nurse will then make a keen assessment to see if this patient is having or displaying stroke symptoms. These symptoms are unsteady gait, visual disturbances or blurry vision, facial weakness or droop, arm or leg weakness, speech slurred or incomprehensible, and they will also assess how long are you experiencing these symptoms. Once it comes to the determination that this is a potential stroke patient, we escort the patient in to a designated stretcher area in the main ED, and we do a finger stick, we do vital signs, and we announce the stroke code. When we announce the stroke code, we will escort the patient to the stroke area, and the stroke team, which is inclusive of the ED attending, 3 nurses, and the stroke team will do further evaluations for this patient.
I agree with everything that Ms. Simpson has said. As the ER physician, we overhear the stroke code that's activated by our frontline nurses, and we go to the stroke assessment area and we help to expedite the patient's movement into CAT scan. CAT scan is the first and really the most important test that we have to do for our patients in a timely manner. And while we try to get them there as quickly as possible, we try to get that CAT scan performed within 25 minutes of their arrival. Of course, we always strive for success, so sooner is better, and it can help to improve the outcomes for our patients.
I would say that in the stroke breakdown of our patients, about 40% of our stroke patients come in from walk-in triage. And then 60% of the other stroke patients come from EMS. And simply based on the characteristics of our patient population, it really is astounding and bold of you to have 2 forms of entry for both of your stroke patients. That is really wonderful. That's amazing that you have 2 lines of entry for the stroke center, because it really starts with your care. The first 24 hours of a stroke patient is the most vital. It will dictate how the patient's being taken care of. Now, there's some treatments that are available for stroke patients. There are medications such as alteplase or TPA, and there's also mechanical thrombectomy for selected stroke patients. Tell me, have you had any experience about patients who've received this type of therapy, Dr. Taitt?
Yes, absolutely. It's really important for us to know when the last known well is for the patient. That helps us determine which treatment is most applicable for the patient. So TPA is a clot busting medication, and within 4.5 hours is the window of time that we are able to give that medication and help to ensure the best functional outcomes for the patients. So I've definitely had patients that have received it, and it's a medication that goes in through the IV, and we do our best to rule out patients who are not good candidates for it. But once they're an optimal patient, we give it to them, and they get admitted to the stroke service. Thrombectomy is a different treatment altogether. It's a procedure that is to remove the clot and to restore perfusion to the brain. So that's also another option that's available for patients within 24 hours, and that can also help improve patients' functional outcomes as well. And I've had patients do well getting both of these treatments, but it's really just mostly important that patients come in as soon as they notice these symptoms, as soon as they're concerned, and that will help us help you.
Time is brain. They say that for every hour on the hour for large vessel occlusion patients who are essentially a clot in one of the major vessels in your brain, your brain ages 3.5 years on the hour. With that note, time is your enemy when you take care of these stroke patients. What are some things that you measure? What aspects do you perform in the nursing perspective to really ensure that you optimize the treatment during a certain time period?
So once the medication is given, or when the patient presents with stroke symptoms and they're cleared from the CAT scan, we have a algorithm that we measure the patient's functionality and respond to therapy. So if the TPA medication is administered, we post-administration, we monitor their vital signs, the GCS, the NIH scale, the neurological scale, Q 5 minutes for the first 15 minutes, and Q 15 minutes for the next 1 hour, and Q 1 hour for the next few hours that they are in the ED. The goal is for us to admit these patients and get them to the stroke stroke admitted area.
The highest incidence of any type of side effect from the reperfusion therapy is in the first 2 hours. So those neurochecks are really vital to take care of these patients and to make sure that there's no side effects and minimize the effects of the side effects. Wow, it's a lot of resources, and a lot goes into taking care of the stroke patient in the first 24 hours.
I mean, this is true, but at the end of the day, it's our patient's functional status, it's their lives, and we can be on point and we can try to meet these measures so that we can improve their functional outcomes.
What measures are you talking about?
So we have, from a physician perspective, we try to get the doc to the patient within 10 minutes. We want the neurologist to the patient within 15 minutes. We want the CAT scan performed within 25. And then we want the CAT scan read within 45 minutes with the goal of giving TPA to a patient within an hour of their arrival, if not sooner. So those are things that we try to accomplish on the front end so that the patient can improve on the long-term end.
Those are some really bold metrics, and certainly fortune favors the bold in this aspect. But I will then now ask you, because we all have family members, we all know that we have friends and families who have risk factors for strokes. What is one thing that you would like to tell our audience that will be a tip or a pearl that you can say about our stroke patients, and to really help us taking care of these patients in the first 24 hours when they present to the ED?
I think prevention is worth an ounce of cure. So a lot of stroke patients have multiple risk factors: high blood pressure, diabetes, irregular heartbeats, obesity, and these things can be prevented in the years preceding a stroke. So whatever you can do in terms of following up with your primary doctor, following up with the other providers that you have in the community, these things can help prevent strokes and poor functional outcomes in the future.
Wow.
Yes, so it's good to be prepared. Make an assessment of your family. Have good communication and check on your elders. There is an acronym, Be Fast. If you see someone that normally walk with steady gait, that means walk perfectly upright, and now is unsteady on their gait, that could be a trigger to say what is going on with your family member. If there is complaint of visual disturbance, if they're complaining of, they cannot see or they're seeing blurry visions, that is another concern. These are triggers. Facial weakness, or if you see there is facial droop, one side is, different from asymmetrical, or they complain of arm weakness or leg weakness, or if they normally speak with great comprehension and now they're slurred in their speech, those are clinical signs. And one or more or three of those signs could indicate that they are having signs and symptoms of a stroke. Time is of the essence. Please call 911 and do not attempt to bring them in yourself. The best intervention is to call 911 and let they do the intervention and the transport to the hospital.
Thank you so much for those words of wisdom. I certainly have a growing and ever-growing appreciation for the ED department. Thank you, Dr. Taitt and Ms. Simpson, for your time and coming in and talking about your perspective of stroke care at Kings County Hospital.
Thank you for having us.
Thank you so much.